Just share the new data that's showing COVID hospital admissions going down statewide. But is the same happening right here in the Midstate? Are doctors and nurses seeing some relief? Kayla Schmidt joins us now with the answer. Kayla.
Yes, well, Valerie, for 2 years, we have been hearing how hospitals are overcrowded and that doctors and nurses just can't catch a break. Well, according to Midstate doctors, that break might not be far away. In fact, it might even stay that way once it arrives.
COVID hospitalizations nationwide are now on a decline. Midstate doctors are encouraged by this trend, but it doesn't mean the pandemic is no longer a problem.
Our numbers of people who have been admitted but waiting for a bed are down on the order of 50%.
What would you like to see it as?
I'd like to see it at 0.
In January 2021, before vaccines were widely available and before boosters were introduced, UPMC saw a daily hospitalization rate peak at more than 300 COVID patients. Right now, a full year later, Dr. John Goldman says there are about 170 COVID patients admitted across UPMC's 7 hospital system.
So really in the last couple of days, we've seen a dramatic decrease.
Dr. Goldman says this weekend was the first time they've seen below 200 patients cared for on any given day in the last month. WellSpan hospitals are seeing a similar decline. Infectious disease doctor Raghav Tripathi says a wave of Omicron spread quickly through unvaccinated people and those due for a booster.
There was not a lot of susceptible population left. There was a precipitous drop towards the end of January, and we are hoping to see this downward trend continue.
If we want to see this trend continue, he says vaccinations are the way out of the pandemic. And he doesn't just mean vaccinating the United States. He's talking globally.
As you know, most of these variants are emerging in countries where vaccination rates are abysmally low. And those are perfect breeding grounds for more dangerous variants.
And UPMC Dr. John Goldman says the vaccine is so critical that if you are between the ages of 50 and 64 and unvaccinated, you are more likely to die from COVID than someone who is 80 plus and vaccinated. In the studio, Kayla Schmidt, ABC 27 News.
Thank you, Kayla.